The reason I want to do this, a brief discussion on this topic right here, the reality is that a lot of women are being given a very minimal amount of the research and evidence that's available to them in regards to making a truly informed decision on whether to have their ovaries removed if they find out that they have a mutation, they have damage to their gene or gene expression. And the reality is genes respond to your environment. They will turn on or turn off, and the reality is you can turn things on, you can upregulate even with a genetic mutation. You can upregulate the expression of those genes. They just don't work very well. We'll upregulate them, increase the ability for them to express or respond to the environment you provide for them, what you do for them. And we're going to talk, I'm going to give you a couple tidbits, snidbits, kind of like snozberries. I like to give out snidbits. You remember when I did that? Snidbits are kind of like snozberries. Snozberries taste like snozberries. Come on, watch that movie. That's my tidbit right there, my snidbit. Just laughter is really good for you, and I like to make myself laugh. So anyways, we're going to talk about this subject, but I'll give you a couple tips on how you can actually reduce your risk by upregulating the expression of BRCA 1 or 2 genes, even with mutations. And there are actually herbal recommendations I'll give you, and I'll go briefly on those, and we'll go through them in more detail, those research studies, later date. All right, so stay tuned, tell your friends and family, all right? Never mind. All right, I love joking, sorry. All right, so this is the thing, cancer experts, they lauded Angelina Jolie's decision to remove her ovaries. The fact was 2 years after she had a mastectomy, she had both breasts cut off, and I can't understand because I'm not a female. I'm not in her shoes. She lost her mother at 56 years of age, so her mom died at 56 from ovarian cancer. So I can understand that fear is very gripping in that situation for those individuals such as herself. But women need to be given the full picture, the full amount of information. That's what we're going to be going through is research studies on the removal of your ovaries, especially if you're premenopausal. If you've not gone through menopause, you're not around the average age of menopause. If you have your ovaries removed, there's substantial increases in overall mortality, as well as a lot of life-type negative effects, because it really messes up your hormones. And yes, you could say that hormone replacement therapy can do a little bit of good for you, but the reality is not nearly what your body can do naturally. And the reality is I wish women were given the opportunity to understand that they can upregulate the expression of the BRCA1 and 2 gene mutations, and those genes can be upregulated even with a mutation. So they applauded her, which I think is quite comical, because in the same article that they posted on Reuters is scientists and experts applaud her. Meanwhile, while saying that it was courageous and influential. She was courageous, she was influential, but the reality was her doctors weren't very educated. Why? Because they said the benefits of doing this are actually unclear. Why are we applauding people for following a theoretical idea? And I can understand it's courageous, but it was influential, and then actually another report noted that within a very short period of time, her announcement that she was going through this surgery increased healthcare spending for genetic testing and oophorectomy and mastectomy prophylactically without having cancer disease at those organ systems, that just having some downregulation or poor responses of those genes, having mutated genes, have damaged genes. Women went out and spent $14.1 million additional dollars on healthcare testing and procedures, just like Angelina Jolie, which again, these doctors who applauded her said the benefits were unclear of whether it actually does anything. And the Angelina Jolie effect was that people went out and got testing and went through these procedures. Very sad to see so many, okay? So we want to talk about this real quick. Breast cancer risk after salpingo oophorectomy. So having your ovaries removed if you have the BRCA1 or 2 gene mutations, the carriers of this. They said revisiting the evidence of risk reduction. So we're actually going to go to the research study here, and I'm going to kind of scroll through it for you. All right, I'm going to read some stuff to you, and you're going to get directly from this document so that it's non-biased information. You guys Again, you can Google the title there. It's right there in front of you on the screen. But the reality is, we're not going to do the TWD today, all right? I'm going to get you a ton of these documents and research articles in a future. I want you to pay attention throughout the entire month of October to the information I'm providing to you to get a understanding and grasp on all of it. And then at the end of October, on October 29th at 6 p.m., there will be a local chat here in Clarksville in my office, so you can attend locally if you'd like. Tickets are completely free. I will not charge for information, all right? But the reality is this will be a phenomenal talk. You can watch online as well. In the meantime, in just over close to 2 weeks, we're going to have Dr. Patrick Flynn, CEO and head honcho of the Wellness Way. He's going to be coming into town speaking to women about hormones. So we're going to have a hormone talk. All right, the Hormone Connection Seminar will be here in Clarksville. It's an attend only. To be and hear this talk, it's attend only. So you must be here in attendance in Clarksville. So fly in, travel in, however you need to get in here. Get here, rent a donkey, I don't care, get here. All right, it's an awesome talk. So, but you have to be here in person. So that'll be on the 19th of this month at 10 a.m. So back to the research study, here we go. All right, breast cancer risk after the oophorectomy, and what did they find? And here's what happened. So previous studies have reported, and the reason they did this study was because breast cancer risk reduction of approximately 50% after risk-reducing oophorectomy. So risk-reducing surgical oophorectomy, having your ovaries removed surgically, all right, we're supposed to reduce the risk of breast cancer because of the theory and idea, which have some substantial information on it, that some cancers can be promoted, the growth of cancer can be promoted by estrogen, all right? So we need to clarify first that estrogen can drive the development of breasts, which then can drive the development of excessive growth of cancer cells, but it does not cause cancer. Hormones don't cause cancer. Hormones can feed cancer. We need to understand that. Your hormones would not hurt you. It's if your hormones aren't going down the right pathway, all right? We can see this in women that we take through a Dutch study, and we can see that they have their liver not functioning well, and they can take the pathway, the estrogens can take the pathway towards a DNA, which then would result in DNA mutations and damage. And if that occurs, now they have an increased risk of developing cancer, but it wasn't because of the estrogen, it was because of the poor function of their liver and the wrong pathways their body was going down. All right? So if your body functions properly, it promotes a healthy pathway. So we need to understand that. First of all, estrogen hormones don't cause cancer, but they can feed cancer because of what they signal. Breasts respond to estrogen. Cells in your breast respond and grow to estrogen, but they respond in appropriate time periods of your life. Now, if you have a major malfunction, a disease process, you have cancer, estrogen can promote the more rapid development and growth of that cancer, but it doesn't cause it. I hope I made that clear enough at this point. We can go through more detail of that later. All right? So they would estimate that 50% less breast cancer, but it's specific that you understand that just because a study says you have less risk of dying from breast cancer doesn't mean you have less risk of dying early. All right? You can die earlier from other causes because of a medical procedure or drug that was supposed to prevent breast cancer, but because you die earlier from something else, you bias the statistics in the direction of a finding that says we reduced breast cancer mortality. Yeah, because you increased dementia and suicide and cardiovascular disease, which we're going to review the studies in just a minute. All right? They were subject to several biases. All right? So they went through the evidence. They did another study, and they found that breast cancer risk reduction with this surgery for BRCA 1 and 2 gene mutation carriers may have been overestimated because of bias. Using the design of maximally eliminating the bias, we found no evidence for a protective effect. So we'll go through some of the thoughts here in this article. All right, let me kind of enhance here. All right, the uptake of latter intervention is high, up to 75% among BR1 and 2 mutation carriers, especially because gynecological screening does not contribute to early ovarian cancer detection. So they say, hey, you have this gene mutation, let's go ahead and remove your ovaries because there's really not a study or early detection testing like mammography or pap smears. So then women will oftentimes go through oophorectomy because they have mutations. But that doesn't mean you have a less risk of dying. Please, please stick with me so that you can see the studies on that. Health effects of risk-reducing surgery will not be investigated in the randomized clinical trials. However, they won't do this in randomized clinical trials because you can imagine that a group of 100 women aren't going to enter into a study where, and all of them be okay with, hey, if you have this, we're going to randomize you. We're going to do an oophorectomy and surgery here on 50 of these women, and 50 of you will be randomized. You don't know who you are, which one of you be chosen for surgery or no surgery. Some women might not want surgery. They might want to have more kids. So they would not want the surgery. So they're not going to allow themselves to be randomized. That's what it means. So it makes it difficult to fully analyze this information. You have to observe through the women who choose to do it and through the women who choose not to do it, which can have health-seeking behaviors that are different and can have health choices that are different. A lot of times you probably imagine that if a woman is smoking a pack of cigarettes every single day, eats a horrible diet, and doesn't really care about her health in life, she's probably not going to be like, yeah, rip my ovaries out, you know? She'd probably be like, yeah, I don't really care about my health, so I'm not going to choose one of the, you know. So that's the risk there. So healthy user bias sometimes in medical studies. But three major types of selection bias are cancer-induced testing bias, so certain tests induce cancer, immortal person time bias, and informative censoring. So those are the biases they say are most prevalent in this type of study. For a detailed description of these types of selection bias and the possible consequences, please review supplementary materials available online if you want to look at that. These are just my highlights. And again, some of these, like that supplemental data is just something I highlighted. Oh, I'm going to look at that. So again, there's the selection biases. And everybody's probably getting dizzy by watching my screen right now. I'm just reading you my notes. We replicate the approximately 50% breast cancer risk reduction. They took their data and they could replicate it if they held true to the study biases that were used in other research designs. Here is an interesting fact. The numbers of deaths were similar in both groups, actually a 2.3% in the surgery group. So 2.3% of the women died by the end of the study in the surgery group versus 1.9% in the non-surgery group. Now they do say this, but in the non-risk reducing group, so the non-surgical group, the women who didn't have their ovaries removed, the group of women died at a younger age. Now, some may say, whoa, they died at a younger age, I want the surgery. Don't jump to conclusions here, all right? You have to understand that the women who did not go through surgery, they were on average 33 years of age, all right? Median ages were 44 for the surgery group versus 33 years. So it wasn't average, it was median. Median age was much younger, all right? Which then would make sense that if the median age of the women not doing surgery was much younger, and the median age of the women who chose to do surgery was much older, you would see the median age of the two groups kind of fall in line and be similar in terms of the age population. So there was a median age of death higher in the women who were already older. That's what it shows. But again, you have to realize there was more women who died in the group who chose to undergo surgery. But you could then argue, I know I'm going to confuse people here, but then you could argue also that, well, those women are older, so they have more risk of cardiovascular disease, more risk of stroke, more risk of diabetes, more risk of all these other things. And that's absolutely true. But it didn't reduce the risk of dying. Actually, there was a higher risk, okay? So, we observed no differences in breast cancer incidences between those who went surgery and those who did not. But look at the statistics. 12.1% of those who did the surgery, and all of these women, all of the women, all the women had these mutations. So they had the BRCA1 and 2 gene mutations. Those who did surgery, there was 12.1% had breast cancer diagnoses. And then they had a 9.9% in those who did not get the surgery. So it was actually slightly higher in those who chose to have the surgery, which is supposed to be preventive of breast cancer. Obviously not. Likewise, breast cancer incidence rate over the risk-reducing surgical surgery group was not different from that in the non-surgery group, okay? Breast cancer incidence, again, was not different. We found no evidence for breast cancer risk reduction after surgery with these mutation carriers. These findings support our idea that the previous studies the consistent finding of a reduced breast cancer risk of surgery, ovary removal, may at least partly be a result of bias. So that is a major study showing that, and most women are not given this stuff. Participants opting for risk-reducing surgery, which again doesn't reduce your risk, were born at earlier years and were older at the start of the observation, so that biases, so it's a potential bias there. You can see actually on this graph right here in front of you, solid line is those who did not go through surgery, and the ones who did go through surgery, you can see the breast cancer, cumulative breast cancer risks were not declined. And actually at the very top there, way to the right-hand corner there on the screen, around 68, around 60 years, 62, 64 years of age on up, those who underwent surgery actually had a slight increased rate of breast cancer, okay? So BRCA1 and 2, BRCA2 associated breast cancers, mainly ER positive. So this is interesting. This is additional information that many women are not given. If you think about the BRCA1 versus the 2 genes, those who have the BRCA2 genes have an increased risk of ER positive. So that would be estrogen receptor. So that would be a hormone receptor positive type of breast cancer. But BRCA1 gene mutation carriers, breast cancers are ER negative, meaning estrogen receptive negative, and triple negative is the most deadly type of cancer. So they would have a higher risk, in essence, of being diagnosed, not of total risk of being diagnosed with. The difference there. A breast cancer risk reducing effect of oophorectomy may be expected in BRCA2 mutation carriers, being that it's estrogen positive type of cancer, but not in the BRCA1. So if you have BRCA1, there's evidence there that given that BRCA1, the one type mutation, has less risk of being diagnosed with an ER positive, an estrogen positive type of cancer, an estrogen fed type of cancer, versus a BRCA2 gene. You know, if you have that mutation, you have a higher risk of an estrogen positive, estrogen fed type of cancer, all right? So that would ultimately, in my clinic, that helps us determine if whether somebody's ER negative, ER positive, those types of things, whether their gene mutations are present. We can better understand how to either upregulate and improve the responses and expression of those genes, versus somebody with estrogen, we know how to better treat and assist them in getting their body back to a level of function that helps them reduce the overexpression of both cancer and helps them process and detoxify estrogen from the body, which would then reduce that fuel for the fire, the development of cancer. So we have shown that the findings are reduced breast cancer risk with the surgery, with those who had these mutations in previous published studies, may at least partly be a result of bias. Using a simple, more valid method of analysis, we found no evidence for breast cancer reduction in these individuals. So surgery didn't prevent breast cancer, didn't reduce breast cancer. There's more women dead who, in the group who had breast cancer, or not breast cancer mastectomy, but had the oophorectomy, having their ovaries removed. Here's one of the studies, and if you actually read the study, and I'm not going to go through this one completely because This is one of the studies they reference as a study used to promote oophorectomy, having your ovaries removed. Hysterectomy, you remove the hysteria from a woman, remember? That's why they name it that. Oophorectomy, you remove the ovaries. A hysterectomy, you remove the hysteria from women. Yeah, that's why they named it, ladies. I didn't choose the name. Don't hate the mailman. Don't hate me. But that's why they call it a hysterectomy. Somehow medical physicians thought we could remove hysteria from women having hormonal problems if we just did hysterectomies on them. That's why they called it hysterectomy. Yeah, sad. But that's the mentality of the medical community sometimes. So, oophorectomy is having your ovaries removed. Well, if you read the studies that promote oophorectomy or say oophorectomy, having your ovaries removed, reduces your risk of breast cancer. It might reduce your risk of breast cancer, but doesn't reduce your risk of dying. Okay? Out of 44 women in this study, I believe it was, let me look here real quick if I can find the exact number. So they use a criteria. We identified 43 surgical subjects. I apologize. 43 surgical subjects and 79 controls who chose not to but had the mutations. At the end of the study, out of 43 women, 10 of the women out of the 43 got breast cancer despite having an oophorectomy, having their ovaries removed. Having your ovaries removed was said to be preventive of breast cancer, but obviously not. But they did see an decreased association between breast cancer mortality, dying from specifically breast cancer, and the other compared to the other group. So you've got to understand why. Here is why. So here is something that biases these studies. All right. Premature menopause or early menopause long-term health consequences. A major research study. This is NIH public access. So what they found in this study, women who experience premature menopause before the ages of 40 years especially, or early menopause between the ages of 40 to 45, experience an increased overall mortality. Cardiovascular disease, neurological diseases, and psychiatric diseases, osteoporosis, and other complications and issues. Regardless of the cause, women, you have to understand this, regardless of the cause, women who experience hormonal menopause or estrogen deficiency, which would be caused by having her ovaries removed. Remember, the entire purpose of having a woman's ovaries removed, because they have a positive test, which there are many women having false positives. Your genetic screening is not 100%. Many women have a false positive, leading them to false decisions or decisions with false information. Wrong information leading them down a path to make bad decisions. Realize there are consequences. See, to me, I would say, why don't we use the herbs, God's medicine, that upregulates the expression if they have these genes? I don't care if they do or not. There would be benefit to women to including in their diet herbs that upregulate the expression of healthy genes. The response of genes would be to prevent cancer in the first place in all women. There are benefits to all women. Some would benefit more than others, but the reality would be there would be a benefit with better nutrition and herbal supplementation because these herbs help our body function, detox, fight off infections, many different positive benefits. Meanwhile, a risk-reducing, quote-unquote, risk-reducing surgery, oophorectomy, having your ovaries removed, which doesn't reduce your risk of dying, increases your risk of dying. All right? Regardless of the cause, it can include surgery. Regardless of the cause, deficiency before reaching the mean age of natural menopause or an increased risk of overall mortality. Estrogen replacement appears to mitigate some but not all long-term health consequences of premature early menopause. So you can take drugs for the rest of your life. You might reduce your risk a little bit of some of those consequences of having your ovaries removed, but not all of them. The practice of prophylactic bilateral oophorectomy at the time of hysterectomy has increased over time. However, incident evidence for long-term risks and adverse health outcomes following induced menopause is starting to accumulate. So literally, as we see the risk of, or the use of removing your ovaries increase, When you have a hysterectomy, having basically your female parts taken out, and they can conserve your ovaries, or they could not conserve them. So they've seen oophorectomy included in that. They're just, we'll take everything out and we'll give you drugs for the rest of your life. That's kind of the mantra of the medical system, sadly. But as that is increased, so is the evidence showing that it's seriously harming women. So consequences of induced ovarian failure include premature menopause, infertility, vasomotor symptoms, vaginal dryness, dyspareunia. I don't even know what that word means. I remember having to look it up. Weight gain and osteoporosis. Approximately 1 in 9 women aged 35 to 45 years old have undergone hysterectomy, with 40% undergoing bilateral oophorectomy at the same time, resulting in the abrupt onset of menopause. The practice of prophylactic oophorectomy, you take prophylactics to prevent something. So, has increased over time, more than doubled since 1965 and 1990. Meanwhile, reports now link the induced menopause from bilateral oophorectomy with serious health consequences, including premature death, cardiovascular, neurological, osteoporosis, and additional menopausal symptoms, psychiatric problems, and impaired sexual function. So women, please, please get this. Just the fact that sexual function, having sex more often, is linked to actually better health. Obviously, people who are healthier probably want to have sex more, so there's a bias there, but the reality is a good physical exercise is good for all of us. So, but here's the thing. Premature menopause, the consequences of having your ovaries removed increases overall death. So the previous study I went through that basically said removing women's ovaries, if they have these mutations, reduces the risk of dying from, emphasize, from breast cancer, means only one cause of death is reduced. Well, it's pretty simple to reduce the cause of any other cause of death if you shoot somebody with a 9mm. All right, so if the surgery is like a 9mm and increases the death rate from fatal stroke and heart attack while you're on the operating table, and more women are dead that got the surgery, well, there's not enough women alive to show the statistical same amount of breast cancer. So you can say if women are dying from cardiovascular disease and overall mortality, not just breast cancer now, they're dying of many other issues, well, before they get the chance to die of breast cancer, then yeah, you reduce the risk of dying from breast cancer. A Mayo Clinic cohort study reported an increased all-cause mortality in women who underwent prophylactic bilateral oophorectomy before the age of 45. So before the age of natural menopause is one of the substantial things you need to understand here. The serious increased risk of overall mortality and problems occur when it's done before natural menopause, okay? That's when its risks are much, much greater. There's still some risks in women who are over the age of 45 and 50, but the risks are far, far greater in women who are younger than that. Nurses' Health Study, oophorectomy, having your ovaries removed before the age of 45, was associated with an increased risk of coronary heart disease, even when analysis was adjusted for known cardiovascular risk factors for use of estrogen therapy. Still, even with estrogen therapy, you still had increased cardiovascular risks. Oophorectomy at any age was an increased risk, above 45 or under 45. Of any age was associated with an increased risk of death, including coronary artery disease and lung cancer deaths. Ladies, no one would have to choose between one cancer or the other, but the reality is, if you had to choose between breast cancer and lung cancer, choose the breast cancer every time, all right? Because lung cancer is far more deadly. So in essence, women should be given the truth, which is, if we do this procedure, your risk of dying, overall, your risk of dying early is much greater than if we don't do the surgery. And also, if your worry is about developing cancer, we are going to increase your cancer risk to one of the most deadly types of cancer, which is far more deadly than breast cancer, which is lung cancer. Women should be told that. And I bet you a lot less women would be deciding to have this surgery. Mayo Clinic cohort, cognitive impairment and dementia was also seen. Parkinson's disease was seen. Greater risk for anxiety. Treatment with estrogen did not modify that risk of anxiety. Increased depression symptoms. Increased link. A link between oophorectomy and depression has been recognized for many years. Significantly greater anxiety, depression, and less positive well-being. Sexual symptoms were not ameliorated by taking estrogen. So the sexual issues, so vaginal dryness and different sex drive, everything like that. Well, guess what, women? Having your ovaries removed, but if the doctor told you, hey, we can just give you estrogen and we'll be able to take care of that and you'll be fine, that's wrong. Sexual function was still impaired despite being given a drug. Family history of breast cancer, ovarian cancer, or the BRCA 1 and 2 mutations is oftentimes what drives people to do the testing and have this done. Bilateral oophorectomy was increased hot flashes, night sweats, vaginal dryness, dyspareunia, weight gain, loss of interest in sex. Estrogen therapy reduced but did not eliminate vasomotor symptoms and was associated with an increase in vaginal dryness. Women who underwent oophorectomy, having your ovaries removed, mean age, roughly, the average age around 46 years of age, experienced poor physical functioning, greater pain, less vitality, poorer social functioning, greater discomfort, less satisfaction with sexual activities at 1 month. However, many of the symptoms improved 6 months except for hot flashes and sexual impairment. So, prophylactic bilateral oophorectomy at the mean age of 48.5 years, experienced more palpitations, heart symptoms, constipation, pain, stiffness, osteoporosis, musculoskeletal diseases following the surgery compared to population controls, even after adjustment for hormone therapy. More likely to be satisfied for the sex life and partners' relationships, which then negatively affects marriages and relationships. So, there's a lot of negative effects, not only to the individual who's here. So, premature menopause, early menopause, whether spontaneous or induced, associated with long-term health consequences and premature death. All those things we've already mentioned. Estrogen mitigates some, but not all of the consequences. Most common interpretations of these findings is that premature early menopause is the first step in a chain of causality leading to tissue or organ dysfunctions and lesions via hormonal mechanisms. Evidence in support of this hypothesis is limited, though the hypothesis that ovarectomy removal improves health status, postmenopausal ovarian. So they have a lot of evidence, they're basically saying. If you read this study, they have a lot of evidence that we will increase your risk, not we, because I'm not part of their group. They will increase the risk of a woman's chance of dying if they remove her ovaries. Especially, all ages, yes, but especially in women under the age of 45. So, that being the evidence that is strong, they still convince women with a biased and weak evidence of saying it prevents their one cause of death, which is breast cancer or ovarian cancer. Postmenopausal ovary. Postmenopausal ovary is a hormonally active, producing small amounts of estradiol, estrone hormones. That's what the ovaries do. Concern about the risk of hormone therapy following publication of the results from the Women's Health Initiative clinical trials may be inappropriate if applied to women with premenopause or early menopause who typically need estrogen and adequate replacement dosage for duration long enough to reduce the consequence of prolonged estrogen deficiency. It is important that clinicians not withhold health-promoting estrogen replacement for these women. So they're arguing for the use of estrogen, but again, it reduces some symptoms, doesn't necessarily remove and reduce all of the consequences. So, and that is it for that study. Another study, which you could go and Google and find real quick, survival patterns after oophorectomy in postmenopausal women, a population-based cohort study. Mortality was significantly higher in those who had received prophylactic bilateral oophorectomy, having your ovaries removed under the age of 40. Approximately, though, this is one of the things that really kind of upset me when I was reading through this research stuff. And all the research, as much as I can. I've not read all of it. I shouldn't say all, but the evidence that is out there that having your ovaries removed increase your risk of death. you probably wouldn't want to dance anymore because your sexual function, yeah, maybe you do want to dance, and it's like, hey, listen, no sex, let's go dancing. Might be good for some women. But here's the reality. Approximately 300,000 women are thought to undergo prophylactic bilateral oophorectomy every year in the United States. But yet the evidence. So the first sentence in the introduction to this study, and Lancet Oncology, 2006, 300,000 women are led to do something that for all of those women who are under the age of 45, the risk of dying goes up. All of the women, all 300,000, the risk of dying goes up. Women under the age of 45, the risk of dying goes up substantially. And they deal with a lot of health consequences. All women in the referent population who met these criteria were regarded as eligible. So that's eligible. I always kind of highlight eligible criteria information. Mortality was increased for women who underwent bilateral oophorectomy because of a benign tumor or inflammation. The women, those younger than 45 years of age at time of surgery, had significantly increased mortality compared with the referent women of the same age at the index year. So women who did do the surgery, increased risk of dying. Consistent with the findings for prophylactic oophorectomy, women with underwent bilateral oophorectomy for benign conditions and had estrogen deficiency before age 45 had a significant increased risk of death. The increased risk of death due to many different causes. Risk of death was significantly increased for both estrogen-related cancers and all other non-cancer causes. Listen to this, folks. In particular, the risk of death was significantly increased in women who had their ovaries removed for both estrogen-related cancers and all other non-cancers. Furthermore, despite the small numbers, mortality for neurological or mental disorders was significantly increased. Neurological mental disorders increased as well. Discussion: risk of death was increased in women who underwent this surgery procedure under the age of 45. Estrogen deficiency seems to increase the risk of death independently, an indication of oophorectomy. The excess estrogen-related cancers in the 79 women who were not given estrogen treatment for age 45 years was unexpected, 39. The excess estrogen-related cancers in women who were not given estrogen treatments. So they saw an increased risk of estrogen-dependent type cancers. That should blow every single person who says, and literally including myself just now. I'm like, holy cow, now I even need to rethink some of this stuff. You had your ovaries removed, which was supposed to reduce and does reduce your estrogen, which when you look at the ability of chemicals in our environment, atrazine or other chemicals or estrogen-like phytochemicals, or not phytochemicals, but chemical estrogens, estrogen-like chemicals in your cleaning products, your hairspray, your skin care, water bottles, all that stuff binds to cell receptors and kind of lodges itself in there to promote the expression of cell replication over a longer period of time than what your natural estrogen would. But if you had the natural estrogen in your body, it would bind and then relax. So it wouldn't promote long-term the expression. It isn't as a strong promoter of that. And that's why you could actually then look at the fact that they removed ovaries, the woman produced less estrogen naturally, but then allowed for the accumulation of unnatural estrogens, chemical-like estrogens, that then bind and cause overexpression of the genetic expression of cancer and other things that are promoted by estrogen. Chemicals bind and promote it stronger than your natural estrogen. Again, your body wouldn't do something, produce something that harms you unless it was a response of something else. And that is the wellness way criteria to helping someone is, how can we figure out what can we test and what can we do to identify the underlying factors to understand why the woman's body or why the person's body is doing what it's doing right now. Why is it producing higher amounts of cholesterol? Why is it producing more estrogen? not enough progesterone. Why is it producing higher cortisol levels? Figure those things out, fix the underlying factors, eliminate some, or enhance the body's ability to promote proper pathways, cleanse the liver, lots of things, and guess what? The person begins to heal and function the way they should. So, for women who died of an estrogen-related cancer, oophorectomy was probably a marker of pre-existing condition or genetic predisposition. Ovary conservation would not have improved outcome. So what they're saying there is women would have died no matter what. Even though we saw an increased rate of having an estrogen-positive cancer in the women who had their ovaries removed and thus their estrogens reduced, well, how can we give an excuse? Their excuse is, and their argument is, that may mean they were already predisposed to having cancer and these health problems, and that whether they had their ovaries removed or not wouldn't have made any difference. Well, then women need to be told that. Women should be told that, listen, the evidence shows us that we can do this procedure, but it really doesn't help you at all. And in fact, some studies are leading to the evidence that we're causing more harm. Women need to be given the truth. And that's what I hope you guys are all getting out of this series that I'm doing throughout the month of October. However, this was one of the funny, okay. However, the population of Olmsted County is mainly middle class, well educated, and has excellent access to medical care. So women were more likely to choose to have an oophorectomy if they had excellent access to medical care. Sadly, they had excellent access to ridiculous medical care. It wasn't excellent care. Excellent care would be giving women the truth, giving women the full understanding of the evidence, not just saying, hey, we remove some body parts and you might reduce your risk of cancer, but you reduce your risk of dying over here. No, they don't tell people that. Excellent care is the truth. They may have had excellent access, and this is the problem with things like the Affordable Care Act. It's just funneling my tax dollars into the hands of big pharma and medical community members who are willing to do these surgeries that don't increase the livelihood, the quality of life, or improve total outcomes. They actually reduce total outcomes. They increase healthcare expenditures. We're giving women access. Listen, they need support from their community members if they're in an accident. God forbid something does happen to them. We should support and help our brothers and sisters. But the reality is, the medical system is raping and pillaging our entire society by lying to women, not giving them the truth, leading them down a false path or ideology that removing body parts somehow saves lives and prevents death. But it doesn't. That's what women believe it's going to do. But that's not in reality of what actually happens. So, I told you I'd give you a little bit of snidbit, like snozberries. So a little snozberry action here. All right. Okay. So modulation of BRCA1, 2, or BRCA1 protein induction of apoptosis and triple negative breast cancer cell lines. Polyphenolic compound curcumin turmeric. Get you some turmeric. It increases the expression of BRCA1. It caused DNA damage in cancer cells, but not in healthy cells. And also, it promoted phosphorylation and total expression and retention of the BRCA1 proteins. See, these genes code for the development and production of proteins that are anti-cancer or signal for apoptosis, programmed cell death. So if they're not expressing themselves correctly, if they're not responding in that way that we would want them to respond, because our environment and the way we're treating ourselves or taking care of ourselves isn't allowing or triggering them to respond appropriately, then they're going to respond by shutting down and not causing cell apoptosis, which is programmed cell death. Cancer cells are cells that aren't dying appropriately. BRCA1 and 2 genes promote the production of proteins that signal for apoptosis. So if they can't produce these proteins because our environment and the way we're taking care of ourselves are causing them to respond in such a way that they begin to shut down or are damaged, guess what? We're promoting cancer. So if we start eating more turmeric, we can actually upregulate. Why aren't women with this mutation told that right there? Resveratrol, one of the best sources of resveratrol, which we carry through the Wellness Way. We carry liquid turmeric. I'm telling you, it's by far one of the best and most potent. In my office, I carry fenugreek, and what we do for patients, if they want it, you'd have to. You cannot get access to Wellness Way supplements unless you are under the coaching or supervision or direction of a Wellness Way physician or doctor. So you'd need to at least consult with me to be able to gain access. I do appreciate that. I hope everybody appreciates me giving this information. The only way I have the ability to give this information out is because I can afford the production crew, the technical, cameras and all that fun stuff. All right? So I give you this information. I would greatly appreciate it if you'd support us financially, all right? So consult with me if you want assistance and help, 931-591-2010. And you can consult with somebody that you already have an understanding that I understand the evidence and research and I can guide you down the path to wellness better. But also, if you just want access to supplements, all you got to do is consult and set up an account with us, and then we can start getting you these supplements. Turmeric, if you want a turmeric supplement, I highly recommend we utilize turmeric with fenugreek. Fenugreek increases the bioavailability stronger than even black pepper. I know that a lot of people have heard about black pepper. Also, don't go thinking that curcumin is the best thing out there. Yes, the reason the majority of studies show and say curcumin is the good thing in turmeric, it's all good, all right? The reason they say curcumin is good is because what science wants to do, sadly, what science wants to do is they want to take credit from God. Turmeric is what God created and said was good and has massive health benefits for us. Turmeric, the root. Meanwhile, scientists, medical community, drug manufacturers primarily, they want to find an isolated compound, develop that into a drug because isolated compounds are what you can patent. So if they can create a synthetic form of curcumin, they can then patent that as an anti-cancer drug. Rather than teaching people about the benefits of fenugreek and curcumin or fenugreek and turmeric as a whole is far superior. That's what we see in the research for its anti-inflammatory medicinal properties. The sum of all the parts, everything that's in turmeric is far better, all right? And we combine it with fenugreek because of the increased bioavailability. Resveratrol, another example which we carry through, is Japanese knotweed. By far the best herb for the most amount of quality resveratrol. It's an invasive plant, which I thought was kind of unique considering the fact that we are seeing so many health problems, cancer, Lyme's disease, and many others are increasing in such dramatic rates. Meanwhile, God provided this invasive plant. Invasive means it grows like crazy, and it's very hard to get rid of. So many people will spray this with chemicals if it's down around the rivers and stuff because it seems to want to take over. But if we are harvesting all the roots and giving this supplement to people who need it, battling cancer or Lyme's disease and many other conditions, other types of infections and problems, guess what? We could be saving lives with something that agriculture wants to call invasive and a pest. Yet I'm thinking God created it to grow so wildly because he knew we were going to need it like wild in the future. So other fruits and vegetables, especially cruciferous vegetables containing endo-3-carbinol and genistein, which is found more prevalently in soy, which at a time, in circumstances, soy can help women with breast cancer. Yes. So, but you need to understand the entire arena, the entire picture of what's going on in that woman's body, hormonally, and genetically. So there we have it. So that's your snidbits, like snozberries. They taste real good. Well, Japanese is not really that great tasting. That's why we have it in capsule form. But some of our herbs are not great tasting, but they're really good for you. So, Ashley, do we have any questions?
Yeah, we got a couple.
Sweet, sweet. Throw them at me.
Okay. So, if you have no ovaries and a family And what do you do for estrogen? I'm struggling with hot flashes and many other symptoms. My name's Lori.
So Lori we need to look at what your hormones are doing. That is a difficult one. Most women are going to go to bioidentical hormones, and there are other herbs. There's using soy in that situation, things like that. So you would have to use herbs. You'd have to use what is called phytoestrogens. So phyto meaning plant-based estrogens. So they have a lower expression than the chemically, synthetically derived or created estrogens or Premarin. Pre-Mayer urine, so that is what they use with hormone replacement therapy, is an animal derived, which is a lot stronger it seems. So when you have your ovaries removed, kind of like when you have your thyroid removed, there is going to be a time and need for hormone replacement to try and reduce the risks or symptoms of that hormone deprivation. Now, being clear, having a clear understanding of what your hormones are doing and what your hormone balance is, once you start taking those phytoestrogens or that medical drug, you have to understand that there are a lot of things that can be done to downregulate the risk factors, the risks of taking a drug. So like lung cancer is increased if you have a thyroidectomy and you take Synthroid, and if you have thyroid and take Synthroid especially, you have an increased risk of lung cancer because of the oxidative stress that Synthroid causes. So you need to get to the underlying cause if you still have your thyroid. If you don't have your thyroid, I recommend more glandulars. Glandulars can be taken instead of Synthroid in that example, like Armour Thyroid or Nature Thyroid, those types of things. In female estrogens, you're going to have to supplement with phytoestrogens, or you're going to have to supplement with like Premarin or Pre-Mayer urine, Mayer, a horse urine. So that is where they extract the estrogen that they give you. But understanding where your hormones are, testing it regularly, and working to balance out and reduce the other risk factors, cardiovascular disease, other cancer diseases, understanding how your liver's functioning, doing all that is going to reduce your risk of overall death, mortality, and breast cancer risk. What's another one, Ashley?
Not sure if you've already covered it here or if you plan to, but what about the women who get cut, tied, burned versus removal and a great sleep?
So I think she's referring to like tubes tied. They got an ablation procedure, like my wife. Things like that, I think, is what it's.
Yeah, instead of removal of the organ.
Yeah. So in those circumstances, it's always go back to, was an elective surgery just to prevent pregnancy? If they have issues, you've just got to do testing. Appropriate testing in all circumstances is ultimately going to lead us down the path to best understanding what we can do for those women in their circumstance or situation. So, got some applause, some yay, yay, yay. Any on Instagram?
I'm seeing just some like agreeing, asking where they can watch it, rewatch it again.
Watch this video.
Yeah, I told them where.
Sweet. So we'll usually put these up, and when we start putting them up on YouTube, I will get it. I'm just kind of holding references hostage. Again, you can Google the references that I read to you, that type of thing. It'll stay live on Facebook, and eventually we'll put it up on YouTube. Then it'll go to thewilddoc.com. Please, please, please subscribe to thewilddoc.com. Building that subscription list allows me to stay in contact with you, especially with the substantial censoring that's taking place on YouTube as well as Facebook. So because of that, staying in direct contact through email is the best way to go forward in the future in case I'm ever kicked off to those platforms for speaking the truth. But again, I love to speak the truth because I'd love to see them do it, because I might have a pretty strong lawsuit against them considering I'm reading research, and you really can't say anything about somebody reading research like they're lying. Well, I read that, so you're saying the author of this Lancet journal, they lied. Okay, well then go prove them wrong. Don't chastise and condemn me for reading the research. So, but anything else on Instagram or anything like that? Otherwise, applause and everything like that. Awesome. I appreciate you all. Hopefully this is beneficial for everybody. Women having a greater understanding if you're not in that situation already. Hopefully you never are in that situation. If you're considering going through genetic testing or anything like that, please seek the advice of somebody that's going to lead you down the path to greater understanding and teach you, not just say, hey, let's do this test, and if the test is positive, let's rip your ovaries out. or let's cut your breasts off. Neither procedure increases overall survival. Neither procedure increases your quality of life. There are substantial detrimental effects to having that procedure. If you've had that procedure already, my heart breaks for you, but know that much can be done to improve your quality of life with somebody who's going to test your hormones, all of them, all your estrogens, going to look at your liver function, going to look at your methylation pathways, going to help you understand how you can change your lifestyle in a way that would better promote the proper production and balance of all the hormones and the proper amount of supplementation when necessary with either medically derived, horse-derived, or phytoplant-derived estrogens. So we can help you with all of that. 931-591-2010 is the phone number for my office if you need assistance. We can help people across the entire world. I have clients all over the world. And also, if you need assistance here locally, you know what? We got my office here in Clarksville, Tennessee. I have people travel in, so many options. If you're in California, Hawaii, Alaska, or Canada, it doesn't matter. The reality is I'm here to health coach you on the path to the wellness. Show you the wellness way. All right, everybody. Love you. Appreciate you. Take care.